And we are live.
Okay, welcome back. This is the Health and Welfare Committee meeting of January 11th. So we are meeting today with members of the Agency of Human Services, and we have with us the Commissioner and Deputy Commissioner of Department of Mental Health. So why don't you, before you introduce yourselves, I'm going to have the committee introduced because we have 3 new members, and we're going to start on the screen behind you.
Hey, good morning, all. This is Dave Weeks, Senator from Rutland County. I hail from Proctor. Good morning.
Senator Bullock.
Martine Barak. I live in Burlington and I am a new senator in this Chittenden Central District.
Oh, great.
Yeah, nice to meet you.
Nice to meet you.
Terry Williams, Senator from Rutland County. I live in Polk.
Oh, great. Nice to meet you. So when Senator Weeks is here, I'm surrounded by Rutland. I'm not gonna let him forget it. Senator Hardy will be back in. She went out to have a chat with Dr. Levine, I think.
Oh, sure.
So why don't you introduce yourselves for the record and then give us, an overview of DMH and maybe some of the priorities that you have and how we might be working together going forward.
Sure.
Good.
So good morning. For the record, Emily Hawes, Commissioner for the Department of Mental Health.
And for the record, Allison Crown, Deputy Commissioner, Department of Mental Health.
We have a PowerPoint that eventually Nicole is, do you want to introduce yourself as well?
Oh, yeah, so my name is, for the record, my name is Nicole Stasio. I am the Director of Policy for the Department of Mental Health. I'm disabled from screen sharing, so I keep trying to get out.
Okay, so why don't we do that? But we do have your PowerPoint here, so
Great.
go right ahead.
Okay, sounds good. So I'll start off just framing out the mission and vision for the Department of Mental Health. So the mission is to promote and improve the health of Vermonters. And the department resides under the Agency of Human Services. It has the same critical mission, which is to improve the conditions and well-being of Vermonters and protect those who cannot protect themselves. Our vision is that mental health will be a cornerstone of health in Vermont. People will live in caring communities with compassion for and determination to respond effectively and respectively to mental health needs of all citizens. We also want Vermonters, and they will have access to effective prevention, early intervention, and mental health treatment and supports as needed to live, work, learn, and participate fully in their communities. So I'll run through a few of the things that DMH focuses on. So we're responsible through statute for the mental health system of care. As a department, we're comprised of around 265 staff. 200 of those folks are within our facilities, the Vermont Psychiatric Care Hospital, and currently Middlesex Therapeutic Community Residents. The DMH budget operates around $287 million to support the mental health services to over 25,000 Vermonters. Additionally, we oversee the 10 designated agencies, as well as 2 specialized service agencies. I'll highlight quickly for you all the Vermont Psychiatric Care Hospital. That is a 25-bed adult facility located in Berlin, the top of the hill. Folks there are under the care and custody of the commissioner.
Can I ask you very quickly?
Sure.
How difficult would it be for this committee to take a field trip to that facility?
We love field trips. That sounds great. We'll coordinate that
With Alex.
with Alex
Good.
and the VECH team.
Excellent.
So we're happy to do that. Currently, we also have the Middlesex Therapeutic Community Residence that is in Middlesex. For folks to be aware, we are in the process of moving that program to Essex.
That's the other one we want.
Yep, that's the new name will be River Valley Therapeutic Community Residence.
Yeah.
For folks who aren't aware, Middlesex was one of the response efforts of the state from Tropical Storm Irene. And it was a temporary facility, and so we're moving into a permanent facility and expanding that program. And it is the state's only secure residential. Additionally, we manage several contracts and grants to peer organizations. We have contracts for forensic psychiatry. We do psychiatric consultation with primary care, and then also a VCHIP contract to conduct analysis of population level data related to mental health. That's those are a small sample of contracts. We have many grants and contracts to support Vermonters. Additionally, we partner with local hospitals, our community providers, police departments, courts, and pretty much anybody you can think of, we're partnering with them. Let's see. It was hard to know if you went through those different points behind me, did you?
I did.
Oh, great.
Yeah, it's going great.
Great, all right, I'll take it. So I'll turn it over to Deputy Commissioner Croft to summarize this slide.
So I think when it comes to what our priorities are and how we're talking about how we're identifying gaps in the system and the vision we have for where we want to go, we're putting things into the category of someone to prevent, someone to call, someone to respond, and somewhere to go. And so at the department, over the past couple of years, we've been trying to build up the somewhere to prevent. You'll see that in the resiliency and trauma prevention position that was provided to Agency of Human Services that is situated at DMH. That position we've just been so lucky to see how well it's gone, and they are really well respected and valued, but serving so much broader than just the department.
You're talking about the position for trauma prevention that was in the secretary's office and then has been moved to DMH, and that's actually something that we would like to hear about in here, not necessarily today, but have greater depth to understand the role that it plays and linkage with other prevention pieces. That'd be great.
Yeah, no, we would love to talk about that. And I
Good.
think the big news is also that we now have a partner for that person in the prevention world, and it's our Director of Suicide Prevention. So that was a role that was we put through last year, and they were hired and they started last week, and we are very excited. So you'll be welcome to meet them and talk about how maybe that role connects with Kaya Ganguly's role.
Excellent.
Someone to call. We've had a lot of efforts to bolster someone to call. 988 is probably the most public, and that was to bring more of a centralized. We have this wonderful crisis system in Vermont where that's localized. But if you are just a regular person in Vermont, you may not have known that number, you may not know they exist. So 988 was a way to say, whoever you are, wherever you are in the state, if you are in a crisis or your child is in a crisis, here's a number to call. That went live as a 3-digit number in July, and we've had great success. That's something we could talk more about and show data at another time. But in addition to someone to call, we've got the Pathway Support Line and the Crisis Text Line. Someone to respond. This has been a piece where obviously staffing crisis is impacted, but we've also been building over the past few years through stakeholder engagement, we meet with families and say, what aren't you getting? How would you like your services to be received? And so many of them have said, we really want someone to come to us. In my old job, I was a crisis clinician for kids. And when the parents would call me, if I had to say, well, you have to put them in a car and take them somewhere to get them to me, it was incredibly overwhelming for them. So this was them saying, we really want you to come to us. So we're building, you'll see a request for proposals that the department put out for mobile crisis response. And that's what this is. And it's also a benefit that we could tap into for Medicaid to get a higher reimbursement rate. So that's something the state's really interested in building and sustaining. In terms of someone to respond, obviously there's a great need to sustain and stabilize the designated agencies and special services agencies. So we have data on how much funding has gone out. And I think that's a very top of mind conversation for both of us on how we can make sure that if they're stable, we have a less need for higher levels of care. So that gets to someone to respond. And then lastly, somewhere to go. So you'll may have seen, and I'll just alert you to a few requests for proposals that the department has put out. One is for a youth inpatient facility. We have the Brattleboro Retreat. They're the only youth inpatient facility in the state. And we are one of our big initiatives and visions, and this is also coming from AHS, is integrated care, meaning that if you call and you're a human being and you have a mental health need, it's quite possible and likely you also might have a substance use need or a medical condition. And right now, with it being the only place to go for youth, being a place that has no medical care, that's been a barrier to some youth being placed there. So we're looking to diversify, and we're asking for a more integrated space for youth inpatient. Additionally, you'll see an RFP for, we're looking at community-based adult residential facilities. That's something we've been interested in. We put out an RFI for that, so let me just clarify. The RFP was for psychiatric urgent cares. So that's something that we're personally really excited about. It's a space in the community to go that's an alternative to an emergency department. And we're very interested in the responses we've gotten from across the state to stand something like that up. And then lastly, children's residential and micro residentials. Those are of great interest right now. We're talking about it with our partners at DCF and other departments to make sure that youth have a space to go if they reach a point where they really need something more intense. So hopefully, I know that was real quick.
That was great. You hit so many different things. And on a lot of the issues that we hear about all the time. So
I'm sure.
that's good. So I do have a question, but I want to open it up for the three senators who are here. So we'll start with Senator Barack Blewett, and then we'll go to Senator Williams, and then Senator Weeks if you have a question. And I'll go last. I don't mind going last.
Thank you very much. This is great. Really, really appreciate that. I would imagine that the hospital workers, healthcare providers are really happy to see kind of a focus on facilities, creating places for folks to go. Do you feel confident or somewhat confident that if and when we're able to build and or find these structures that we'll be able to staff them? And if not, is there a plan for staffing?
Yeah, I would look at it as us needing to focus on staffing all of our levels of care. And so yes, we've targeted some inpatient or facilities, but we also have numerous openings throughout our system, and it takes all of those entities to be fully staffed to have the system be working like a well-oiled machine. So we've done some great work partnering with our designated agencies around community staff. I think Vermont as a state has plans and thoughts of how to bring workforce into the state, as well as potentially utilize folks who may not be in the workforce yet. And so those are all on our radar for future planning to staff. So we understand that there's a balance of growing programs and facilities, and we also want people to work in them and also get services in them. So I think there's a long road ahead to solve our workforce crisis, and we're all on board to figure out the best path forward for that.
Thank you.
Senator Williams.
On the mental health issues, and this is local, so I've heard about it.
Sure.
We were invited to a medical society meeting, and the biggest theme of that meeting was emergency room was overwhelmed with children that have mental health issues. They were filling up all the rooms on the 5th floor of the hospital. Is there any plan to expand treatment facilities to the other parts of the state?
Sure. Do you want to talk a little bit? I think there's sort of different prongs. There's maybe 3-pronged approach to supporting folks. So we currently, Deputy Cronk talked about investing in mobile crisis support so that folks aren't having to necessarily go to the emergency room if they don't need to. So meeting people where they're at. We also discussed our RFP for inpatient psychiatric care. But then also Deputy Pronk has been leading some great work around alternatives to EDs, and we could talk a little bit more about that.
Yeah, so those mental health urgent cares I spoke about before, some regions of the state are looking to develop them specifically for a population. So you'll hear the word PUC. There's one down in Bennington. PUC means psychiatric urgent care for kids. And so there are some who are saying, well, you know what, we're going to start with children and youth, because for us, that's what's pushing the limits of our emergency departments. Others are using their data to say, we actually think we're in a decent place with youth. We're going to start with adults. So those conversations are happening. And thankfully, we've seen a lot of communication between hospitals and the community mental health to try to figure out how you can target those resources.
I think it stemmed from the COVID, but they were overwhelmed. They were, the medical staff was leaving, they were having trouble getting nurses or emergency room techs. And I told them I'd address it.
Yeah, COVID exploited all of the things that I think needed to be exploited in a lot of ways. More people are acknowledging that friends and neighbors are experiencing symptoms of mental illness, and they're open to talking about it. And people are also seeking treatment, and we want people to seek treatment. Treatment is available. Yes, COVID is part of where we're at right now, and I can see that from a positive and a negative side.
Senator Weeks, did you have a question?
No, I just wanted to thank both of you for the overview. It's very informative. I look forward to working with you over the future, but I have no additional questions. Thank you.
Terrific. All right, thanks. A question, but I think probably there'll be a time when you can come back and we can talk about the identification of the needs in the community. And I know that I don't know that you are, but I know the agency is looking at Act 167 and trying to understand what the needs are and then where the services are. So are you working within the agency, with the agency?
We're working closely with the agency on all initiatives.
Okay. We don't need to. Do you work with higher ability at all?
Oh, through Dale?
Yeah. Okay. That's a great program.
They've done some great work over there.
I know. Okay. Anyway, good.
Thank you.
Thank you.
Yeah.
This, as I've told people, this is the tip of the iceberg.
Oh, yeah.
So you've just given us food for thought,
Great.
and we'd love to have you come back.
Yeah, we'd love to. Thank you.
That's good. Thank you.
And it's a pleasure to meet you all.
Yeah, nice to meet you.
Good. So now we can find Dr. Chen and Mrs. Katerina, I hope. And we'll try to scoot along, keep our time somewhat within reason. We take away time from us, right?
That's fine. Thank you.
Thank you.
Yep. Oh, Dr. Chen, no, go ahead. Okay.
You can come on in. You're good to go.
You have a seat right there.
Okay.
Good to see you.
All of us?
Good to see you.
Yeah, we've got plenty of room now. I think we're a quota of 10. Okay. Good. Very good.
I did share the presentation.
Yes, you're welcome to sit there, or you can sit over there. If you're gonna be speaking, you're gonna stay right there.
Yeah.
Right up on the screen. I think Alex. you
I can put the slides up or
Okay,
if you
great.
prefer to. whatever.
We're gonna skip some because we sent you a
Yeah,
pretty
but
long
maybe let her
presentation.
have control of it, because then I'll.
Okay.
If you have the Zoom information, I can let you in.
Perfect.
Well, I see. We can do it for you.
Yep. And I made the abbreviated one, so. Keep up.
While you're getting started, we think we'll go around the table and have the members of the committee introduce themselves. They don't know you and you don't know them probably, except me. But we're gonna start behind you with Senator Reed.
Good morning to both of you. I'm Dave Weeks from Rutland County. I come from Proctor, and I apologize for not meeting you in person, but I went to bed last night with a slight cold and woke up with a full-blown cold, so it's really not appropriate to be in the room today. But thank you.
Good to meet you, Senator.
Hi,
I'm Martine Rock-Ulick. I live in Burlington and I am a new senator from the Chittenden Central District.
I'm Terry Williams, I'm a new senator from Rutland. District, live in Polk.
I know you. I'm Senator Jenny Lyons. And Senator Ruth Hardy is out talking with someone and she'll be back in hopefully. Okay, so thanks for being here and also being patient with our schedule. We're getting used to legislative time all over again. We're looking just for an overview of GCF and then some of your priorities and where we'll be working together, because I know that's gonna happen.
Sure.
Okay.
So good morning, Senator, Madam Chair, and Senators from the Health and Welfare Committee. So we have a lot of ties. I live in Burlington. I spent 30 years at Rutland Regional Medical Center in the emergency department.
And he was a great
I've seen
ED.
it.
He was a great
Yeah.
ED.
I was a frequent flyer.
So there's a lot of connections here. So it's just Vermont, isn't it?
Yes.
And so I'm here with Katerina Mazias, my legislative taskmaster.
I like that name.
Absolutely, and certainly she could be a resource to this committee on an ongoing basis. I'm delighted to present to you what we're about in terms of the Department for Children and Family. And kind of a couple things I wanted to start with. Just
You
some
might want to
numbers.
just state your name for the record.
Sure,
That'd
so
be-
that's I forgot that.
Yeah.
Dr. Harry Chen, Interim Commissioner, Department for Children and Families. And let's start off with our mission. So just kind of some numbers to remember. We have 1,000 employees. We touch roughly 200,000 Vermonters a year, so that's almost 1 in 3 Vermonters. We're all over the state, and it's really about reducing poverty and homelessness, improving the safety and well-being of kids, creating permanent connections for children and youth, and financial assistance for children, individuals, and families at a time of need.
So you included that, the Reach Up program.
Yeah, it's all there. It's all,
Critical, yeah.
and we'll go through some of that.
Yeah, good.
Our vision is Vermont, a place where people, kids, families are prosper, they're safe, have strong relationships, and individuals reach their potential. Our mission is to foster healthy development and safety, well-being, and self-sufficiency for Vermonters. So I think it's always important that, we're here to talk about the what, but I think it's also important to understand the why. And what we know is, we traditionally talk about health and well-being in terms of hospitals and doctors, but we also know that there are things we'll call them the social determinants of health. And these are the things that ultimately provide the foundation, which I think we're very clear that how people thrive and are healthier based on these social determinants, whether it's a house on your head, whether it's a job, whether it's a place for you to recreate, whether it's freedom from violence or racism. All those things are vitally important to our health and welfare of our populations, and we'll see that we touch a lot of those in terms of the services we provide. Next. So here's just a brief overview. Again, 1,000 employees, 6 divisions and offices across the state, 200,000 Vermonters. There's family services. Makes sense. That's where we take care of kids and families. That's where both in terms of child safety, child welfare, and an environment for kids that is conducive to development, permanency, and wherever possible, placement with their families. We have a Child Development Division, which is all about the early child space in terms of childcare, in terms of early child education, in terms of early intervention services. I think all of those things are vitally important, obviously, for what happens later. The Office of Child Support providing a program which helps ensure that kids and families get the support they need from the non-custodial parents. Economic Service Division is our biggest division. That's where the LIHEAP, the Three Squares, the housing, home, energy assistance, and housing, emergency housing come from. The OEO, which is really an agency which primary purpose is to push out funds to other partner agencies. So it's the CAP agencies throughout the state. It's a huge effort in terms of weatherization, and it's working and partnering with all of our homeless service agencies throughout the state. Office of, and then there's the DDS, the Disability Determination Services, which really is our offshoot of the federal government. So it determines eligibility and recertifies individuals who are applying for disability. So in terms of the Family Services Division, it's actually our largest division. It has 407 employees, and it's really focuses on child safety and law abidance for children and youth and emerging adults. It's working with families, foster parents, partner organizations to achieve the best outcomes we can for children and youth in our country.
I'm sorry.
That's okay. We try to keep, we try to achieve a mission by working with families to keep children and youth safe, to keep them free from harmful behaviors, and understanding that sometimes that's not possible. We try to find other safe and nurturing placements for them while we work toward reunification, which is our ultimate goal. And then even in a smaller proportion, we know that sometimes that is not possible. And then we search, find, and develop placements that are permanent, because we know permanency is really vital to development and children growing up to be successful and adults. Okay. So our 4 key outcomes, obviously safety comes first in terms of family services, our kids, permanence, finding the right place for them, but ideally return home, if not guardianship or adoption. That we want to measure and ensure that there's well-being for the kids in our custody, and that the children and youth are free from unlawful behavior. Just as in terms of a number, there are probably 1,091 children and youth that are in DCF custody right now. So I tell my kids I have
How many of those?
1,000 other kids.
How many of those are out of state? Do you know, or is it, that's a discrete question?
Yeah, that would be a question. What I can say is that most of the out-of-state ones would be in the kind of high-end system of care. And that's probably maybe about 100 to 200 kids. But some of them are here in Vermont.
And then one other question, because there's an interest in this committee on guardianship, and so how many of those kids are in some type of
some alternative kind of custody, or I guess we'll have to get to that.
Yeah, we can look at it. Well, we'll get to that, because I know we'll be talking about it at some point.
Yeah. So in terms of our structure of the family services, it's district offices, there's statewide units in terms of child protection, and in terms of residential licensing of our care facilities, and then there's a central office that oversees practices. Next is Child Development Division, 49 employees. Again, really all about the early child space, all about licensing, about child care, child early education, licensing, technical assistance, early intervention with our children's integrated services, trying from birth to 5, to try to, again, ensure that we get to them quickly and early, and to best ensure their success onwards. Head Start collaboration, universal pre-kindergarten oversight with the Agency of Education, and again, all the child care programs we serve, child care providers, understanding that Vermont is a very kind of diverse state in terms of the providers, the early professionals, early education, after-school professionals, and then families receiving what we'll call child care financial assistance, and then families served through Children's Integrated Services. We have multiple projects and programs through the Child Development Division. We have our quality program, QUIS or STARS. We have our information system that really are able to track both the providers and the programs. We are building capacity, understanding. I think if nothing else, we saw during the pandemic what happened and how important vital child care and the early child system is, and then understanding that we do not actually provide the child care, but we support the organizations that do. So it's technical assistance, both in terms of the business side, but also in terms of the professional development side. And it's licensing, regulation, and the revision of that's ongoing now. So important, kind of the regulatory piece of that, but also the technical assistance piece of that. And I won't go through this, but it's fair. Just to give you an example, we spent or pushed out $108 million to providers and the system in response to the pandemic. Understanding that there really is a need.
What was important, stabilization.
Yes.
Let's look at that.
So
I did
stabilization,
look at
right.
this one yesterday as well.
So in terms of Office of Child Support, our mission is really to ensure promote the well-being of families by strengthening that financial safety net and really making that link between non-custodial parents and ensuring that they provide payment and support for their children. And primarily, we know that receipt of child support increases independence of the parents, that it reduces child poverty, reduces the reliance on public assistance. So there's certainly a link between. So as an example, sometimes the payments will actually go to economic services, where the family may receive benefits to actually kind of repayment for those benefits. Reduce reliance on our benefits, encourages parents to exit and remain off public assistance, and increases parental involvement of the paying parents. So it's really a way to keep kids connected with their family, but also support them financially. And in terms of Office of Child Support, we serve the parents who are paying support. We also serve the guardians who are caring for children, and the parents who are actually caring for kids. So there's just that kind of link in terms of making sure that they get the support. There are over 15,000 cases benefiting over 16,000 children. So you can see here that we work with our partners, Economic Services, Family Services, Department of Corrections, Department of Labor, employers, the judiciary, Domestic Violence Network, and associations of business and industry. So all of that is kind of connecting parents with families, with businesses, creating mechanisms whereby we can ensure that the kids are getting the support that they are due.
And it's a difficult system to be in.
It's what?
It's a very difficult system to be in.
Yes.
Yes.
Economic Services is, again, another very large division of DCF, and it provides the economic benefits to Vermonters in need. So this is the safety net in terms of families and individual Vermonters who may be experiencing unemployment, single parenthood, aging, death of a family member, or other life-changing events. And there are, again, 350 staff throughout 12 district offices. We have a central office, and we have an economic service benefit call center, and then we have an application documenting process center. All of this connecting to Vermonters in need. A lot of those 200,000 Vermonters are those receiving economic benefits. And I think truthfully, this is an area where we've seen a dramatic change in the way we work. Because it used to be pre-pandemic, you walk into the office, you sat down, you filled out a form. So now we're really seeing how that's changing, but also stressing the system, because whereas before you had people wait waiting room, now they're waiting on the computers and the phone. So understanding that we have challenges there, and we have work to do to actually try to improve the timeliness of our response.
And the connected.
And it's going to do this. So economic services, most of these are actually federal benefits. And so the advantages, we're using federal dollars. The disadvantages, we actually have to go by federal rules. So just as an example, we were thinking about changing, trying to use a contract to help us with our call center. But the federal rules say we have to wait 120 days to do that. So it's, as you might expect, it's the pace at which the federal government accepts change can be challenging. So the benefit programs, everybody knows SNAP or 3 Squares, which provides food in terms of on the table for reminders. The General Assistance Program, which helps individuals and family meet their basic needs, personal needs, housing, medical, dental, medical supplies, burial costs. The Vermont Rental Assistance Program is part of the GA program in terms of short-term rental subsidy. LIHEAP, which actually, as you might imagine, people are worried about the cost of fuel to heat their homes. And this year we've got a couple bumps of funding, which should help with that. And then Reach Up or TANF, which is helps stabilize families experiencing poverty to help them get out of poverty. So again, we had a lot of transition of related, pandemic-related programs, transition housing. I'm sure we'll talk a lot more about that. The pandemic EBT, the maximum allotment, which is actually going away based on the omnibus bill, and will be a challenge. So people will receive considerably less in their SNAP benefits come March. And also Reach Up Rental Assistance was I think a program trying to really address a certain population, which are families that are homeless, trying to get them into permanent housing. OEO, again, administers grant funding, core funding for the CAP agencies, community action providers, provides training and technical assistance, develop resources for community. A lot of the main areas really are homeless assistance. They support all of the homeless providers, service providers, weatherization, financial empowerment, and the core funding for the community action agencies. And again, I won't go through all this, but OEO was able to push out tremendous amount of money to their organizations. Again, they don't do the work. I call them the small but mighty operation, because they're really focused on working with community partners, funding them, providing the technical assistance, and obviously making sure they're held accountable for the dollars that go out. DDS ensures they provide applicants with medical eligibility in terms of disability governed by Social Security and federal statutes. It's a national recognized as a national leader in terms of accuracy, timeliness, and public service. Again, they work for the 4 federal programs. We have to abide by the federal rules, but we've done that again. The very bottom line, 98.6% accuracy in terms of this determination. So we're very proud of the work that they do. So that's DCF in a whirlwind nutshell. I hope that I'm sure we'll have.
So we know everything we need to know.
And in terms of priorities, I think we're, I think we're focused on the end of the transitional housing program and how we transition the greatest number of reminders to permanent housing that we can, understanding that's not a number that will be, those that are left over, obviously we also need to address in the most kind of beneficial and humane way we can. So housing, the high-end system of care, the kids that are now, children and youth that are now going out of state, Certainly, it is our preference to, where we can, keep them in Vermont. I think additionally, this is not this system is struggling everywhere. And, I've talked to New Hampshire,
Yes.
I've talked to Maine, everybody's really feeling the same pressure. So it's really part of my major effort is to ensure that we're thinking ahead in terms of the facilities and the programs that we need in terms of family services. And then economic services, I think I mentioned that, the new way of doing business, how do we best deal with that in terms of in an efficient manner?
Yeah, good, thank you. There's so much there.
Yeah.
And then the linkage between judiciary and here
Yes.
on some of these issues just compounds everything, and so we're gonna continue our interest. Particularly where TPR might be in determination of parental rights and guardianship and those things that are so really important.
They're important issues and
Yes,
they're emotionally charged issues
they're
too.
emotional issues. Senator.
Thank you very much, Chair Lyons. I was wondering, the number that you gave, the 1,091 children who are in DCF custody, how does that compare to the national average in terms of like per capita? Do you know?
I would have that.
That's a good question.
I believe we're actually above average per capita, but we have made strides in the last few years to be more aligned with the national average, but we can follow up.
Yeah, thank you, that's great. And then my other question was just, we have 3 folks here who are also on education. And so I was wondering, in terms of the departments, which ones work most closely with AOE? And I'm assuming it's CDD and FSD. Is that right?
Yeah, I would
Definitely
say,
CDD.
yes, definitely
Yeah.
CDD. Of course, there's overlap with FSD when a kid is in our
Right,
care or may become in our care. ESD, of course, has overlap because, in our Reach Out program, that also serves families. And as well as the 3 Squares program works very closely with AOE on the school meals programs and the various pandemic food assistance programs.
Okay, great, thank you.
So I guess a lot.
I figured, yeah.
We got time, we have 2 minutes. Go ahead, Senator.
I thank you, Dr. Chen, and Adelina, I'm sorry I was late. I know you can't provide specifics, but you didn't list this in your priorities, and I'm wondering, will there be anything in the governor's budget or proposals about childcare?
Oh,
I know that's one of our priorities.
Yes, and I think like it's mentioned, that obviously there is related to what we saw during the pandemic. I think everyone acknowledges that there's stresses and challenges in early childhood. So there are quite a few initiatives based on that
Great.
coming up.
Well, we look forward to working with you guys on that. Thanks.
Right, he did mention it before you came in,
Okay.
but so it's good. And glad you asked the question again, because it's nice to put a little exclamation point.
Yeah, exactly.
Good work. Any other questions? All right, Senator Williams.
Just one question, I might have missed it. You have anything to do with the foster child care program?
Yes.
Yes.
So that's Family Services Division.
Okay,
And it's, obviously it's a very valuable resource in terms of being able to place children and youth in our custody in a kind of safe, nurturing environment, hopefully temporarily, but important nonetheless.
We also have a very strong program with how youth transition out of foster care when they're aging out of the system called the Youth Development Program. And that's something that, similar to your question, Senator, about how it overlaps across the department is, when a youth is in foster care for a big portion of their life, they're often using other programs at DCF as well.
thank you.
Okay. This has been terrific. We will have you back and we'll dive deeper into some of the departments because there's so much here in particular. We are going to do that on the CCFAP this week. And then, get into areas that are we need a baseline to understand the work that is coming up in childcare and other places. Thank you.
Great, thank you, and welcome
Hey,
to the
great.
new members.
Welcome to you. Yeah, good. All right. Senator Weeks, did you have a question? I left you out of that.
No, given the time constraints, no question. Certainly we'll follow up when we see this group again. Thank you.
I hope you feel better too.
Thank you.
I have to remember, we've got a little hybrid.
He's not very healthy.
Yeah,
Thank you.
take care. Bye. Okay, so we have Monica White and Dale. Aha, I see. All right, we're behind schedule.
All right.
Highly unusual in this building.
Is that sarcasm or what?
How are we doing for people? Jeff talking. Yeah, we can do one more. Welcome. Are you gonna share up on the screen? Have you given her everybody has to do it?
I can't remember where share screen is. Let's see.
We have it. We have what you've got, I think. You may have.
Great.
I'm like, okay, it's only been a few months since I've had to do this. Share screen, the big green button at the bottom. Here we go. All right, y'all ready?
Well, the fluency is the state primarily uses Teams, so it's like,
Yeah.
We do the same thing when we get on Teams.
How does this
Why
work?
do they use Teams?
I do have
Getting
this in
used to it.
paper, if anybody wants paper.
Yeah, we do have it. Alex printed it out for folks. I'm good. Thank you.
Yes, there's her color.
Oh, this is it. Oh,
It's expensive.
beautiful. We don't use paper in here, but cases like this, it's important because we need to have this bottom floor or we can start going on.
All right, you can let me know when it's okay to hit the share button.
All right, well, but we're going to introduce ourselves first, and then I'll have you introduce yourself for the record, and then we'll move from there. So we'll start with Senator Weeks, who's behind you.
Good morning. Dave Weeks from Rutland County. I live in Proctor. I apologize for not being with you in person, but I went to bed last night not feeling well and woke up feeling pretty darn bad. So anyway, my apologies for not being in the room, but nice to meet you.
meet you. Hope you feel better soon.
Hello, I'm Martine LaRock Hewlett. I live in Burlington and I am a new senator in the Chittenden Central District.
Nice to meet you. Congratulations.
Thank you. Hi, it's nice to see you guys. I'm Senator Ruth Hardy from Madison District. Great to see you.
Senator Terry Williams from Rutland County, and I live in Fulton.
Nice to meet you. Senator Jenny Lyons, welcome. And I'm from Chittenden Southeast. And I see more of you on screen than in present. So this is good. Glad we finally getting together. So why don't you go ahead, introduce yourself for the record, give us a little background on Dale, and then maybe some of the priorities and the issues that will be coming here, and we can work with you on
Great.
which we can work with you. Use my correct grammar.
So for the record, my name is Monica White, and I'm the Commissioner of the Department of Disabilities, Aging, and Independent Living, also known as DALE. And I am joined today by my principal assistant, or our principal assistant, Rebecca Silbernagel, who is also our legislative liaison. So in terms of timing, the presentation that we have is very, very robust, and I won't have enough time to go through that in detail. But my intent was just kind of skim through and do an overview of the high level points, orientation for the new senators, and refreshing for the two of you who've been here, been here in the Senate for a bit. So would you mind firing that?
Firing away.
All right, there we go. So the mission of the Department of Disabilities, Aging and Independent Living is to make Vermont the best state in which to grow old or to live with a disability with dignity, respect, and independence. And that really permeates everything we do across our 5 divisions, across the Commissioner's Office. We have, well, next slide, please. Maybe I'll just kind of. There we go. All right.
Okay, yeah, you're
Right, so, and so the mission is, that's what we do as a department, but it really is a statewide priority, I think for all of us. And I know for all of us to really fulfill the commitment that we have made as a state to persons with disabilities and to older Vermonters, enabling folks to receive supports and services that they need in their home to support living independently and fully included as members of their communities. Vermont is a leader across any number of metrics as it pertains to older Vermonters aging well, as it pertains to persons with disabilities, persons with developmental disabilities, intellectual disabilities, employment for persons with disabilities, and that sort of thing. And that's, you know, something that we are very proud of, recognizing that, especially post-pandemic, there's some work to do to really stabilize and strengthen our systems of care generally across the board. On this slide too, I'm not going to go through them, but the commitment that we all as a state have made is governed by a number of state and federal mandates to include the Americans with Disabilities Act, the Developmental Disabilities Act here in Vermont, Older Vermonters Act, and nationally the Older Americans Act, and so on. So I'm not going to go into great level of detail in the interest of being crisp. Next slide, please.
I could use mine.
Okay. Okay. All right. So, so that's kind of the very broad spectrum of our department's goals and targets. But for our department itself, we have about 300 employees, and those folks are statewide. We have about a third of our staff headquartered in Waterbury at the state office complex, and then the remainder across our 12 district offices, and also home-based and pre-pandemic home-based, performing functions out in the community to include adult protective services and survey and certification, among other things. So that's kind of who we are in terms of numbers and where we are statewide. We have about we have over $500 million in our budget across all of our programs. And I'm not going to break into the specifics on this slide here in the interest of time. But so we have our commissioner's office, and our work is comprised or split between 5 divisions. And I would like to spend a bit of time just orienting to kind of the high level where the programs sit in the divisions and what those are at the very high level. And so our 5 divisions are our Adult Services Division, Developmental Disability Services Division, Division of Licensing and Protection, Higher Ability Vermont, which in statute is known as Division of Vocational Rehabilitation. We underwent a rebranding initiative last year to support like a fresher, crisper, and more relatable name. So we refer to that division as Higher Ability.
Are you interested in having a statutory change?
You know, I'm not sure that that's something that we have contemplated, given that there are federal regulations with the federal.
So it's better to keep it as appropriate.
I think so, but that's something we could certainly talk to make sure.
And then the sort of the criteria and principles that are under Higher Ability, because I know how successful it is right now. Really terrific.
Yeah. So, and then the division for the blind and visually impaired. So those are our 5 divisions, and in the next slides we'll do just a bit of an orientation to those divisions. Actually, we can go back up to the next one, please. Thank you. So Commissioner's Office, this is the kind of who's who at a really high level in the Commissioner's Office. You can expect to see and hear from most of the folks who are listed here, depending on testimony topic. And at any time that there's a question or issue or needing more information, certainly reach out to myself, Deputy Commissioner Megan Tierney Ward, Rebecca as our legislative liaison, and other folks here, kind of home to the Commissioner's Office. Next slide, please. All right. So getting into the division, so the Adult Services Division, the division director is Angela Smith-Jang. She's been in that role for a few years and is just absolutely a fantastic champion for the work that occurs within ASD as it's known. And ASD's primary focus is managing long-term services and supports for adults with physical disabilities and older Vermonters. There are 43 staff in that division, and the scope of that focus includes several units. So long-term services and supports units, also known as overseeing the Choices for Care Medicaid program, which provides Medicaid services for folks who are nursing home level of care in the setting of their choice, either in a long-term care facility or home and in the community. And also the brain injury program is housed here as well. Our quality management unit, which provides a quality oversight function for adult services programs. State Unit on Aging works in concert with the 5 area agencies on aging around the state and other partners on a number of issues focusing on older Vermonters, and to include the Vermont Action Plan for Aging Well, work on that front, and that's something that is also in strong partnership with the Vermont Department of Health on a number of metrics there. And we also have the Money Follows the Person project, which is an initiative granted by the federal government focusing on helping individuals who wish to transfer their care from a skilled nursing facility into the home to help tackle some barriers on that front. And the next slide lists some of the priorities within the Adult Services Division. I'm not sure how much time I have and how in depth you want to go, because I do have other.
Yeah, take another
divisions.
10 minutes or so, yeah, good.
Okay, all right, so the priorities as listed here, I think I spoke to some of them briefly, but conflict of interest in case management. Vermont has not been in compliance with federal requirements with regard to having conflict of interest in case management for home and community-based services, and that is a priority at the agency level across all of the programs to include those housed within adult services and our developmental disability services as well. Also development of quality measures in alignment with federal regulations and the renewal of the global commitment waiver, which occurred this past summer. Workforce, and providers.
We haven't heard that before.
Haven't heard that, that's news, new news, right?
Nobody else has mentioned it.
Right, so that is a significant issue. Our state plan on aging, we actually just renewed in October for a 3-year period for the state unit on aging, and the focus on that front. I won't dive down that here, but that's a significant body of work. And the Vermont Action Plan for Aging Well, I mentioned that previously. Money Follows the Person, and also maximizing the use of one-time ARPA. I can't remember that acronym.
Federal funds.
The federal funds. Yes, the enhanced funds that came to us through COVID, specifically for home and community-based services, as enhanced funding opportunities at the agency level. Maximizing use of those strategically to best impact the lives of Vermonters.
Thank
And
you.
we're gonna define FMAP in here fairly soon.
That's it. Okay, excuse me. So Developmental Disability Services Division. So the division director is Jennifer Garabedian. She's been in this role for about a year and is fabulous. I'm sure she will be in this committee at some point this session. And the primary focus of DDSD, as it's known, is managing home and community-based services for Vermonters with intellectual and developmental disabilities and providing court-appointed public guardianship services. 51 staff through that division in 3 primary buckets. The program specialist team to include a inclusive but not exclusive to focus on, we have a position for children's services, public safety, and geographic units there. Similar to the adult services division, we have a quality management unit focused on developmental disabilities, services quality, and our Office of Public Guardian, providing public guardianship services to about 750 folks across the state. Next slide, please. Thank you. So the priorities here align greatly with ASD in conflict of interest in case management, quality measure development. One focus for DDSD in particular is the crisis continuum of care, expansion of clinical support. So finding that the clinical acuity level of folks in crisis in developmental services has reached a point that we have this sort of unprecedented. So focusing some energy on that front to improve that segment of that system of care. Again, workforce provider stability. Last year, H720/Act 186 was passed, and that was really landmark legislation for persons with developmental disabilities. Landmark, I'll just put it that way. Part of that was inclusion of a limited service position, which we have filled, and creation of a focused advisory committee on developing residential alternatives or housing model pilots for persons with developmental disabilities, recognizing we've heard loud and clear that the current housing options in the system are not meeting the needs of everyone. So what would be better? What are those options to consider? And so H720 put in place the framework with which to develop pilots so we can evaluate data and really make some decisions as a system for what we will have moving forward.
I think that will, yeah, that bill was actually fun to work on. I know there was a lot of controversy behind it, around it and everything else, but the outcomes, we would love to hear what the outcomes are and the direction you're going with pilots and how that's all sorting out.
Right. Yeah, I mean, we're happy to come in. We'll actually be at House Human Services tomorrow with an update on that. Yes, we're happy to come in for a larger targeted discussion of this group.
Yeah, and that's part of the bill, that they have the same bill that we have. So we'll maybe have some replication of the information that you're taking there. That'd be great.
Great. And then we have worked over the past couple of years to roll out a standardized, independently administered assessment tool, SIS-A. Payment reform is a focus, as well as, and it's not on the slide, but we recently implemented a new statewide system of care plan for developmental services as of January 1st. And some of the priorities included in that include a mindful focus on supported decision-making and ombud support for persons with intellectual or developmental disabilities. Right, so Division of Licensing and Protection, also known as DLP. The division director is Joe Nussbaum. You absolutely will be hearing from and seeing Joe this year. To jump ahead, one of our large priorities this year is an update to the Adult Protective Services statute, which is decades old at this point. And so Joe has been leading that effort. So I'm getting ahead of myself. So I'm just really excited about that.
Good, that's great. We like updating.
Yes, yes. And so DLP's primary focus is protective services for Vermonters, and the scope is 54 staff statewide, comprised of the Survey and Certification Unit, who provides regulatory compliance and licensure for over 200 licensed long-term care facilities, hospitals, home health agencies, and so that sphere of work. Adult Protective Services, who investigate reports of abuse, neglect, or exploitation of vulnerable adults. Restorative Justice Services, which is a relatively new pilot to gauge engaging alleged victims and perpetrators in a restorative justice process for successful resolution of APS matters. Service Navigators, also a relatively new pilot where we have folks embedded within Adult Protective Services that can help to make some connections for some really thorny situations for reports that come in that might not meet the statutory definition of abuse, neglect, or exploitation, or the person might not be meet the definition of victim in statute, but they need services, and there really have been dynamite resource to be able to connect to community resources that will help in those situations. And also, we have 2 limited service positions known as the COVID Strike Team. Dale took a very outsized role in the heat of the pandemic, particularly given the focus of preventing COVID-19 in long-term care facility settings, and a significant body of work reallocating for people from their normal day jobs to focus on that, and coming into the endemic phase, realizing that COVID hasn't gone away and we still do need to support long-term care facilities. We were able to leverage some grant funding through the Department of Health to fund 2 positions to continue that work, so that in supporting our partners at long-term care facilities and others with COVID-specific supports. So next slide is the priorities for DLP. As I mentioned in my state of great excitement, the update to the APS statute, and very grateful to Senator Lyons, among others, for support of this work, and my understanding that is currently being worked on with Legislative Council.
Yeah, we're going to get the bill in here, and it's going to be there. So we're going to discuss who takes it up first. That's going to be an interesting tug of war. See, everybody wants to do it, so that's good news.
That's good news.
That's great.
Right, and that is, and everybody, I think that, is a reasonably fair assessment, because we had a very robust group of stakeholders involved under the APS subcommittee, and it's universally understood that the statute as currently written is woefully out of date for today's world. So that's great. We also last year we received additional positions, like 4 or 5. I'm trying to like the number right now, but positions for survey and certification to enable us to provide annual surveys at state licensed facilities. So in the long-term care facility world, skilled nursing facilities are governed by federal regulations and requirements through the Center for Medicaid and Medicare Services, whereas state licensed facilities, to include assisted living residences, residential care homes, and therapeutic community residences, are governed through state regulation. And so the resources we had did not enable us to get out on an annual basis to state licensed facilities until last year, when we were able to get some additional positions through that. And we, I believe now are have almost all of those positions filled and prioritizing getting those people onboarded and trained and boots on the ground out there to do that work. Again, some pilot funding on the restorative justice project is a priority. Finalizing update on state survey regulations to specifically for the state licensed facilities, working to focus on adult protective services substantiation rate, and that is sorry, I lost my space here. And then we submitted a legislative report over the summer on self-neglect as a problem, so focusing on self-neglect, and then the strike team positions, continuing those work. Hireability Vermont, as mentioned previously, Diane Balmas is the director of that division, and focusing on helping Vermonters with disabilities to prepare for, obtain, and maintain meaningful careers, and helping employers recruit, train, and retain and promote employees with disabilities. And so, that's an important point. It's maintaining meaningful careers. It's not just, get a job. It's working with each individual person to learn strengths, learn what folks want to do, what are their educational goals, credential attainment, that sort of thing, to really help put people on the track that they want and will be successful in. And there's about 145 staff across the state, focusing on career counseling, so working with folks, working with employers in the area is a big focus, providing assistive technology support for folks who need a device or a gizmo or a gadget or some really, really great equipment to help folks be more able to live and work successfully. And we also, within hireability, have the Invest EAP Employee Assistance Program, which is statewide. And priorities for this division include the Vermont Career Advancement Project, a relatively new initiative. We've now had 2 years worth of a summer career exploration program born out of the pandemic that has been extraordinarily successful and powerful in working with high school youth who have a disability and want to do a deep dive on career and educational focus, including paid internships. And it's really just remarkable work. And we also are working on a pilot, also born out of legislation last year on employment supports for persons with substance use, the opioid focus. We're also really targeting efforts on diversity, equity, inclusion, and access to ensure that we are truly walking that walk for all Vermonters, and performance management of how can we do things better. And our last but not least division is for the Division for the Blind and Visually Impaired, directed by Fred Jones, who focuses on much of the same as Hireability Vermont, specifically for persons who are blind or visually impaired. That's our smallest division with 11 employees, and the services listed here: vision, rehabilitation, employment, high school transition services, assistive technology, business enterprise program, and older blind program are different than hireability, but I'm realizing that I'm being so I'm trying to talk very fast because I think I'm way
That's
over
okay,
my time.
it's pretty clear up there.
Okay.
We're getting,
Okay.
we are getting.
All right, good. And then if you, that's the next one, please. So priorities, we expand the LEAP program, and that is the Learn, Earn, and Prosper program to include apprenticeship opportunities. That is a fabulous partnership with that provides some fantastic opportunities to youth and high school students, college students who are blind or visually impaired over the summer. There's networking, there's education. It's just, I've done some in-person days with folks, and it's really, really fantastic work. Getting a consumer-driven conference off the ground, specifically as it pertains to blindness-related assistive devices. The technology is incredible, what is out there, and making the connection for people who are blind or visually impaired to the incredible amount of technology that's out there to actually make that difference is a big focus for us. And also a targeted focus on persons who are deafblind, so who are both deaf and blind, really drilling down to focus on the needs of that population. It's small, but it's important. So I think that is the end. That's a lot of me talking, and really excited about the work that we have underway and the work that is yet to do, and working with you this session.
It's terrific, thank you. I think what we'll do is we're gonna hold our questions. If someone has a question and need further information, maybe just send it along. Is that okay to send it to Susan? When you come back in, or members of your of Dale come in and we start diving into bills, we'll get more info. Really appreciate your time.
Well, thank you for the invitation. And again, congratulations on your elections or re-election, as the case may be. Looking forward to being back, and I hope you enjoy this sunny but really cold day.
Yeah, we got some sunshine. It's healthy. Takes away sad, right?
That's right.
She's gonna have to get this weather. Doesn't affect us. That's great. Thank you very much.
Okay, thank you so much.
All right. So our last few minutes, we're gonna invite staff in, ask them to introduce themselves, and then we'll come back to our priorities. Thank you both.
Thank
Really
you.
appreciate your time.
Yeah, I understand.
Okay,
So we're gonna get his introduction before his testimony tomorrow.
that's fine. Yeah, that'll be fine. So,
you?
hi,
Good.
I'm Katie. Good to meet you.
Hey, I'm Terry Williams.
Good to meet you.
Hi, Cameron Aberdaly.
Good morning.
Good morning.
So Jen is not coming, Nolan, Jen is here, okay, so the three of you can organize yourselves however you want. And we're gonna talk about our own priorities a little bit later, because we've started, but we're gonna finish. I think it's most important just to have you introduce yourselves.
Okay,
Yeah.
so we'll stay for the introduction. Is that what you're thinking?
You are.
We're still-
You are there.
We are.
We are.
Are you legislative counsel?
We are.
Good.
Yes.
I want to talk to you.
All right, so this will be good. So why don't we get Jen in and then we'll close the door. Oh, sorry. Uh-oh. 1, 2, 3. We've got 3. That's a critical mass. 3. Oh, 2. Oh, 3. Oh, 3. Yeah. So, where we are right now is we're behind in our time. So we've taken off the time that we were going to use to discuss our priorities, and we've put our legislative staff at the top of the list. So I'm just going to ask you 3, you could sit at the head of the table or around the room, and we're going to introduce ourselves and then have you introduce yourselves. We're mostly interested. Have a seat. Katie. Katie's good.
I'm okay.
Are you there? Yeah, so especially for new members of the committee, we just went through AHS. We took all of this. So it's huge. And now you also have responsibilities in your as staff and legal counsel. So you know how those two things jive. And everybody has an interest in a different bill, so they're gonna want to know who to contact. So we'll start with Senator Weeks behind you, and he's gonna introduce himself, and then we'll
Good morning. This is Dave Weeks, Senator from Rutland County. I live in Proctor, and my apologies for not meeting you in person, but just not feeling very well today. Woke up with a cold. Thank you, though.
There is no apology for that. That's
We appreciate that.
Thank you very much. Thank you very much.
Hi, Martine LaRock-Ulick, nice to see you, from Burlington, and I'm a new senator in Chipley Central District. I'm Ruth Hardy, you guys know me.
Gary Williams from Rutland County, live in Fulton.
Fully?
Fulton.
All right. Ginny Lyons. Yeah. Chittenden Southeast, and I live in Willistown, I have to say that. Okay, so, we thought it would be a good idea just to have you introduce yourselves. I know Nolan can't be here today, but he'll get another chance real soon. And then talk a little bit about the areas of interest that you have and how you can help us with our legislation and what you'll be doing for us once we start taking out bills. So, who wants to go first?
Sure.
Right.
I'm Katie McGlynn. So I say that I'm half of the healthcare and services team, but now we're sort of a three-person team. So I'm not sure how the math works out anymore. So I tend to lean more heavily towards human services issues. So that means you'll see me in the room on issues like persons with disabilities, substance use disorder, child care, mental health, public health. So if you have any questions about those topics, you can direct them here and I'll do my best to answer them.
Would you do guardianship issues?
It depends, but possibly.
Okay.
Maybe judiciary, maybe human services.
Yeah.
Depends.
Yeah. We have a lot of committees, so. Do you want to ask Katie any questions? Thank you.
Hi, Ameren Aberjay. So I cover I would say, majority of what Jen's portfolio used to be. Jen, who's now our chief counsel, was in my position previously as the other half of the healthcare team. So you'll hear she has certain discrete topics that have been pulled out, and I have sort of the bulk of the other healthcare topics. So large topics that I cover: health insurance. This would include the health insurance exchange. We're talking about qualified health plans. Talking about state subsidies for healthcare, Medicaid, which is a big topic, long-term care, Vermont Health Information Technology. So talking about Vital and the Vermont Health Information Exchange. Those are sort of the reform. Healthcare reform, yes, sorry, healthcare reform.
Oh,
another big topic. Right. So talking about the all-payer model and accountable care organizations, also referred to as ACOs.
Yeah.
So those are my primary topics. I will be in here a lot.
Sure, I know there's a lot of interest in what's going on out there right now with accountable care, Green Mountain Care Board. I'm sure we'll be talking about that, and then Act 167. But there's a lot of work going on. We're going to probably want to get a little primer on what that bill was. That's 285.
Are you guys doing an overview?
Yes.
Okay. Yeah, I think they're doing an overview of.
Yeah, that's okay. That's great. So anything about an Advantage plan, somebody can ask you.
Medicare Advantage plan, I'm
No.
sort of sticking with some of
doing
that
that?
stuff because it's not traditional health insurance. We
Okay.
haven't really gone to, but for the most part, Medicare Advantage is really federal, so there's not. So if you have questions about that, we're gonna have to refer you to somebody.
So to the extent that we can affect change with that.
We can really affect information, the flow of information about Medicare Advantage. And
and there will be some information in DFR report that's coming out
Right,
shortly
it's
on
coming
that.
out soon.
But otherwise, there really is not a role for the state, and so it's not something that we have focused on.
We're being held hostage yet again. So any questions for Amber? I'm going to see you a lot, I think. Great. Jennifer.
And I'm Jen Harvey. I'm the Director and Chief Counsel for the Office of Legislative Counsel. As Ameren said, I had been doing healthcare for the last 15 years, and I'm still keeping a little bit of involvement in that. So I will be in here doing prescription drugs, tobacco, healthcare finance, end of life issues, that kind of stuff. And then I'm also going to be handling another committee, actually in Senator Hardy's committee, issues affecting the legislative branch and the Pay Act and things like that. So a little bit of a trade-off with Ameren for some of what she used to work on, because she did GovOps.
Oh, that's right, yeah.
So yes, and then, you know, I'm certainly happy to help answer questions and kind of back up Ameren as she is learning this subject area.
Questions for Jen? Discussion. So if we have bill requests and we're not sure about who to talk with about that, can we go to any one of you, or should we go directly to Go?
Yeah, so I mean, in general, you can give your director request to anyone in the Office of Legislative Counsel, any of the attorneys. You don't have to know who's going to draft it. If there's something you're just interested in talking about and you approach one of us and we're not the right person, we'll tell you who is.
Go ahead.
Where are you physically located?
Great question. My office is here on the mezzanine in the State House. So above the coat room, where the mezzanine is. And then
Cameron and I are in the building next door, the pink building, 1 Baldwin Street, and we're on the 2nd floor.
yeah, that's a great question.
I want to note, because I forget this all the time, is you need your badge
Yes, that's
to get in to the
Pink
So
lady.
the pink lady and
into
into
the mezzanine.
And of course,
And if you
mezzanine.
knock, they won't hear you. I just tried it.
That's good to know. Yeah, so, and sometimes, you know, if folks are gonna be around here and this room is available to you, welcome to meet with Ledge Counsel in here, as long as there's not something else going on. And especially if it's not a confidential conversation, but if you're talking about a bill, you may wanna do it more, you know,
Sure.
kick me out.
right. You can always set up a time to meet with us, whether it's in our offices or somewhere else. Meet you in the Senate coat room or
I
something.
will do that. Yep.
All right. Senator Weeks, have you got any questions?
No questions. Thank you.
Okay, terrific. Okay. Anything else? I think we've been through the mill this morning. And we have just discovered about 2,800 more priorities than we thought we had when we walked in this room. So it's going to be a really busy session, but there are a lot of issues and some of the things that we're looking at, frankly, you know, like with the mental health issues that Katie works so diligently on. There's a significant intersection with judiciary and how we can, we're going to have to work together with other committees, and then the Act 167 and the whole healthcare reform area, trying to sort out who does what and how it all fits together where we are. That's another one that goes between healthcare and community services, the way it was structured. So there's a lot. So we'll start, I think, the bill that we have up there is a bill that the House has taken up. And it's my understanding that they'll be passing it out, so we'll be able to actually get it, dive into looking at a bill next week, I think. Is it, you think?
I'm scheduled for a walkthrough tomorrow.
Okay, and Representative Wood thought that it might go pretty quickly, but we'll see how that goes. You never know. All right, so this is good. Thank you. Thank you all for being patient this morning with we did get behind, but we try not to do that. We'll see how it goes, it's legislative time. We're done. I think we can go off.